Dr. Nabeel, Haneefa, clinical cardiologist at the Hospital, Trivandrum. So we'll start with the late updation in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 25% are attributed to cardiovascular disease, which affect around 45% people in around 40 to 69 age group. Raised blood pressure is among the most important risk factors of cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. So in India, the prevalence has gone up to around 38% in the last 30 years in men and around 32% in women from 29% respectively. So the WHO, despite that, the nearly half of the people of, or around 51% of the men and 41% of women with hypertension were unaware of the present condition. So in addition, over 62% of men and more than 53% of women living with hypertension didn't get the treatment. Medications was used to control blood pressure in less than only 1 in 5 men and around 1 in 4 women with hypertension worldwide. This is actually the what WHO latest update in 2021. So International Society of Hypertension, the ISH guidelines has released that global hypertension practice guidelines shows that the inclusion of optimal and essential treatment paradigms attempt to address the usual resource of blood pressure in the poor settings, claims that poor BP control is due to lack of unawareness. The AHA and the ACC guidelines shows that the scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low atherosclerotic cardiovascular disease risk factors. It actually reduces 10-year risk factors with stage 1 hypertension, ranging from blood pressure of 130 to 113 in systolic and 80 to 89 diastolic. Management starts with initially non-pharmacological therapy. If the blood pressure remains uncontrolled at around 3 to 6 months, then we'll start with pharmacological therapy. There's the last updates. So acute respiratory distress syndrome, ARDS, is a potentially fatal condition involving lung damage and exports option associated with severe COVID-19. A recent study which appeared in the Journal of American College of Cardiology report that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure charges down to 110 to less than 130 millimeter mercury range substantially reduced cardiovascular events in the STEP randomized trial, affirming that the sprint findings for an older Chinese population, some among 8,500 patients range from 60 to 80 age in China. The Indians target trimmed around 26% of the composite cardiovascular risk. From a new second major trial supporting a lower target could be unite guideline among the US professional societies ranges from the threshold of 130 to 150 millimeter mercury. With regards to prognostic value of ambulatory blood pressure monitoring, the nighttime blood pressure, that is the 2018 European guidelines on the management of arterial hypertension, recommend that the diagnosis of hypertension should not only be dependent on the office blood pressure, but also the out-of-office measurements, such as ambulatory blood pressure monitoring or home blood pressure monitoring system around 24 hours, and even the nighttime blood pressure measurements were associated with greater risk of mortality and a composite of cardiovascular outcome. Thus, they may be considered as the most important relevant measurement for estimating cardiovascular risk. For every 20 to 10 millimeter mercury increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events increased by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and better BP control. Therefore, the 2018 European guidelines recommend, especially in the context of low BP targets, to start antihypertensive therapy with the initial dual fixed combination of ACE or ARBs plus calcium channel blockers or diuretics. Since early July 2018, containing the valsartan study, which had showed that valsartan had been recalled worldwide due to a detection of a non-carcinogen, namely the N-nitrosodimethylamine, that is a NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. So the NDMA has been classified by the WHO International Agency for Research on Cancer to be a cardiogenic in humans. So the study showed that more in around 1 lakh studies, patients were randomized in this study. We showed that more than 4 to 5 years of patients getting this certain certain and well certain showed more affinity to have this carcinogenic treatment or those who require cancer treatment. So the HYGIA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoints, including death. The HYGIA chronotherapy trial tested whether nighttime therapy, in comparison to usual up-awakening hypertension therapy, experts say favorable cardiovascular risk reduction. The largest study included a total of around 19,000 antihypertensive patients during an average follow-up of around 6.3 years, which showed that more than 1,700 patients particularly experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP variance during the sleep and over the daytime. So the RR reduction of cardiovascular events was relative risk of reduction of cardiovascular events was significantly improved for nighttime treatment when compared with awakening treatment. So it showed that both daytime BP monitoring and the nighttime BP monitoring showed significance in detecting cardiovascular or atherosclerotic cardiovascular disease. Thank you.